The trick with motor vehicle accidents is to kind of intervene quickly. Sometimes we'll have people come in after seeing their lawyers and then asking for MRIs and a couple other things, and a week would have passed. The problem is when you wait a little bit too long, muscle spasm occurs, and as soon as muscle spasm occurs, it's going to ask the other surrounding muscles or compensatory muscles to spasm up, and you just have not only the original pain but the compensatory muscles and associated musculature, regional joint pain. It just gets worse. The idea that I give with my patients is, if you take the example of a bicep is two heads. So if I pull off the tendon of one single head, it's a big blood supply, it'll bleed fast. You'll see black and blue and blood accumulate. That's a given, that's obvious for anybody who's had a biceps tendon tear. The problem with the trapezius, which is back here, the trapezius is a broad muscle. It goes from the mid-back all the way to the shoulder, way up into the neck. And when the trapezius is asked to pull this head back, because in most motor vehicle accidents that are about 30 to 40 miles an hour, 40 miles an hour is when an airbag usually deploys with a front end hit. When your seatbelt holds the shoulders back and your arms are butted or holding the steering wheel, your head will go back and forth. It'll hopefully stop from being hyper extended, which can break bone, but usually this is okay. This is held by the headrest. But when that happens, the muscles of the trapezius will suddenly try to pull the head that's going like this in an arc. So imagine your head 10 pounds going in an arc, muscles asking to pull suddenly and say, whoa, you're going to have muscle tear. When muscle tears, it's going to bleed. The muscles of the trapezius are kind of small and broad versus the big the big blood vessel in the biceps tendon. So you're not going to have a lot of bleeding all at once. You're going to have a slow leak over the course of 24 to 48 hours. That's why after motor vehicle accidents, you go to sleep kind of sore and you wake up really painful, stiff, and sore. So the objective is to stop the bleeding before the pain occurs. I usually suggest those three things: anti-inflammatories, muscle relaxers, and pain control medicines. I had a lawyer come in yesterday. He was kind of beating me to the punch, telling me what I was going to order, and anybody can figure that out. I'm sure he's handled cases where time and time again with motor vehicle accidents, his clients have had anti-inflammatories, muscle relaxers, and narcotics. But I think he was losing the finesse of figuring out which anti-inflammatory works best, how to use a muscle relaxer, and when to use the pain pill. Those are all three very good medicines, but they have to be used wisely. For something extreme, anti-inflammatories are important. Prednisone, the steroid, is sometimes very important to bring down inflammation quickly, especially if you're worried about a shoulder that's going to flare up, neck pain that causes chronic headaches to flare up, problems with low back disc disease that are going to flare up. You want that turned off quick. That's when you go for the big medicines. The big gun medicines are the prednisones, the torodols, the prescription anti-inflammatories. They are useful, but they are riddled with side effects. You have to be careful about side effects. Muscle relaxers work great, but they usually cause altered sensoria, make you drowsy, dry mouth, vision problems. But they do work if you can take some time off. Narcotics, if you have to take them because of 10 out of 10 pain, then you really shouldn't be driving. You should be at home, or seeing a physical therapist, massage therapist, chiropractor, or acupuncturist. Those groups of folks, those groups of healers are the ones that really facilitate the healing process. My medicines just put a little band-aid on a couple things. Those other healers will really help to reverse the disease process and or the spasm that's coming. I also, I love turmeric. I like high-dose magnesium as long as the kidneys are okay. I think St. John's wort is also important, especially with the trauma that might be the psychological trauma associated with the impact. Hitting a deer is kind of spooky, and then you'll have nightmares, so I think St. John's wort is good. But turmeric, magnesium, St. John's wort or skullcap, all very important for relaxing. I love topical medicines as well. There's sandalwood and lavender if you can find essential oils. Also with certain blends you can find helichrysum and wintergreen, which really relax. There's topical patches, which I've referred to in my previous videos, topical treatments that can be used to also facilitate healing. And then you have to lead a healthy life. You can't be taking alcohol, you got to be sleeping properly, and you have to stay away from dairy and gluten if you can. So all those previous things that were slightly irritating, don't do them when you're trying to heal up a muscle spasm. That's usually what I do. I like Theracane use, I like hands-on therapy, so if you can do all this stuff all together, take some time off, you can probably beat that muscle spasm to the punch before it gets to the point where it's all spasmed up and then you're coming in asking for narcotics and time off and a couple other things, slings, collars. We don't like slinging joints if we don't have to, because the effect of a sling is always helpful. The effect of a soft collar is always helpful, but the joint becomes very weak. So with weakness, you're going to have to get into therapy, and there you go. You should have gone to therapy to begin with. So these are all important, and important to know about what's happening or what's coming. Also important to initiate by asking your doc, can I go here, can I try this, are these things going to interfere with my medicines?